So hey friends, welcome you all to Sail to MDS Dental Academy. I am Dr. Malay Trivedi. I am pediatric dentist and assistant professor in College of Dental Sciences. So aspirants, today we are here with the orientation lecture, or we can say the directional lecture. So you all are grown up now, you all are doctors, so I cannot orient you, but my aim is to give you proper direction for your NEET exam preparation, as hardly 6 months are left and you have to show your capability. You have to work hard so much in proper manner, in a smart way, that you can be in the top 300 of NEET exam. So before starting your preparation, you should tell to yourself that you will be in the top 300 regarding your NEET exam ranking. Fine. So as we are told, it's your direction lecture. I'm ready and I'm here for you to give direction. So aspirants, now let us know your exam pattern. So we'll talk about NEET exam pattern first. So it is consists of 240 questions. Multiple question will be there. You will have 3 hours. There is 25% negative marking. It means 1 mark will be deducted for incorrect response, and for correct response you are going to get 4 marks. Then what is the subject wise distribution? Many a time students asking me, sir, which subject is more important and which is less important? Aspirants, you can see in this slide, this is from the NBE only. Here all subjects have equal weightage, and especially medicine and surgery have highest weightage of around 15 marks. That's why in my academy I am teaching physiology, pharmacology and medicine in interconnected manner. We will deal every system once in a month, so what student will get idea that how the system functions. So please know that you have a 2 part of paper. Part A consists of 100 marks, in which your first, second and third year will be included, and part B will be 140 marks, in which all your dental subjects will be there. So friend, what are the question pattern? If you ask me this question before 5 years or just before 3-4 years, you used to have 2 type of question: single based answer and image based question. But nowadays your NBE has added many type of questions, like you will have the single based answer, multiple answer question, image based question, you will have a case based scenarios, you will have a true and false, then you will have the extended matching question. It is what extended matching question means: you will have one theme. On the basis of theme you have to answer the question, then you have matched the following. They are asking sometimes assertion and reason based question. So aspirants, you can see from this slide that you will have around 7 to 8 different type of question pattern. So you have to prepare accordingly in that manner. Don't worry, we will go in that way only throughout our preparation. So a lot of burning questions in student minds. Around 15 to 17 burning questions are there, which I have discussed in my lecture regarding what and how to proceed for NEET preparation. But right now we are discuss main 3 questions. So many times the student will ask, sir, is it enough to read Dental Pulse or Gauri Shankar? So aspirant, just now I have shown you, you have different question pattern. You will only realize that no, these books are not enough to read. You have to clear your concept if you want to get in top 300 of NEET preparation. So what happened? Even you see the last 2 years paper, they are eye-opener. You can see hardly 5 to 7 questions are there from the Pulse, Gauri Shankar, and even also from the repeats. Nowadays those days gone when the questions will ask directly from the book or from the repeats. Nowadays the staff are making new questions. So please aspirants, just don't depend on MCQ books only. Textbook reading, no, you don't have to read full textbook, but you have to refer in smart manner. Later I will show how to refer the textbook. Theory, I can't read. So aspirants, you don't have to learn the theory. It is not your theory exam. You have to clear through the concept. That's why in my academy, I provide my students jerk-free content. It means what? To the point content. For example, if you are taking oral pathology, no need to study 200-300 page for the oral pathology. But let us study some important 500 to 600 points, which is very required and important for your NEET exam. So don't just go on the unnecessary theory. Try to balance yourself between theory and MCQ. So what are we going to do today? We are going to discuss that how you have to proceed for your NEET preparation. So friend, we have in our academy 2 phases of learning, that is preparation phase learning, and second is the revision phase. So in this preparation phase from June to September, I will help you and I will teach you each subject one by one. So all 21 subjects we will see from June to September. So at the end of September, you will be ready with all your 21 subjects. That is for sure. And in learning and revision phase, what we'll do in learning phase, we'll study the combo of subject. Like we study the combo of pedo and endo. We study the combo of oral surgery and general surgery. Like that, we'll go in combination. So you will have one good revision there. And then the revision phase in which we'll study the past controversial questions, past AIIMS paper and past NEET paper. So that will extend from your September till your December first week. And 1 week I will give you a buffer so you can prepare for yourself and for examination. So friend, how to do planning? How to do proceed for your preparation? So mostly we have 3 phases. Synopsis and notes you have to read, MCQ reading and revision. 90% of students, what they do, they directly read the MCQ. Please don't do this mistake. So first of all, you have to read the synopsis from whichever book, like your Pearls, Gauri Shankar, whatever you are reading, you can read. Then along with that, you have to read the notes which I am providing in my lecture, which I am conducting in my lecture in the form of the voice notes, videos and images. So first of all, you have to read that. Then you have to jump to MCQ. And there is one specific pattern of studying the MCQ. I have seen the students have just one pattern. They just see the question and they will go with the answer. Even if they are not knowing what is given in that question, they will go for the answer. So aspirants, whenever you are seeing the question, and if you are not knowing the concept, or if you are doubt that I am not knowing the answer, then you should not attempt, even when you are practicing at your home or wherever. Okay, so whenever you are reading MCQ, 2 things should be there. If you are knowing, attempt it; not knowing, leave it. So what happened when you are leaving such MCQ? First thing, you will have a habit of leaving such negative questions. So your negative marking will be reduced in your final NEET examination. And second, when you are reading something wrong thing, when you are guessing something wrong thing, what will happen? That will get imprinted in your mind. So when even you are study right thing, the 2 options will juggle in your mind. So that should not happen. So when you read MCQ, if you are knowing, go with it. If you are not knowing, leave it. So whatever MCQ you are left, you have to go back to the textbook and you have to read it. So you have to refer those points in the textbook and you have to include in your notes. So in this manner, in retrospective manner, you have to refer the textbook. And aspirants, revision is more important. If you are not revising, whatever work hard you have done will be of no use. That's why study in proper manner. I have seen many students and many people are providing them lots of books, read this, read that, tons of material they will have, but they will read once, but they are not able to revise. It is of no use. So prepare in smart manner. I will provide you all the important points for your examinations, which will help you in cracking it. Then we'll talk about the amalgamation of preparation. So sometimes, we feel bored when we just do the MCQ in a day or just synopsis in a day. So try to amalgam your preparation. Read synopsis followed by the MCQ, followed by the reference to textbook. So like this, if you will do, you will not feel bored in the day. Second, try to divide the subjects. Now you have 180 days left with you. 60% you should give for your preparation and 40% you should give for your revision. So for division of subject, you can follow our academy timetable. Then you have to divide your day. Like for example, you are weak in operative, give more days like 7 to 10. Then there are small subjects like DADH, you can give less days like 2 to 4. So very important that you should divide your subjects. Then you should divide your time aspirants. So you should not, like some people tell, by for NEET MDS, if you want to crack, you have to study 12 to 14 hours. It is not mandatory. It is not the quantity important. Here the quality of preparation is important. So you have to divide accordingly. Yes, today I have to study 5 chapters. It will take 6 hours. Yes, I should complete that 5 chapters. Then only I should sleep or I should go for another work. Like that you have to properly divide. So whenever you are studying, divide your subject, day and time. And the one important thing occurs is how to complete backlog. So backlog means what? Pending work. It is going to occur. So when you study one subject to another, the pending work will be there. So how you to solve the pending work, I will show you. So what I will do in my academy, I will provide assessment form every month. So for example, this is one of the last month assessment form. So aspirants, in that you will have a days assigned. For example, you give 7 operative days to operative dentistry. How many days you are taking? Are you reading my academy notes or not? Are you reading synopsis or not? Are you attending the MCQ practice which I am providing after every lecture? Are you giving online exam or not? Are you giving or referring textbook or not? So like that we have assessment form. So in every assessment form we have one heading that is topic left. So for example, if somebody have left gold filling materials or cavity preparation from operative dentistry, you have to write in such assessment form. I will provide you aspirant. So what happened? When you will write on the paper that this much topic are left, you can utilize when you are studying the shorter subject. Like for example, DADH, oral radiology, they are very short subject. They will take 3 to 4 days. So in that you can give extra 2 days and you can complete such backlogs. So in this manner you have to complete your backlog. Fine. So please try to follow this assessment form. So that will be helpful to you in completing your backlog, and else also they will help to assess you where and how you are going. Then comes the biggest thing, that is a doubt solving. You know, right, previous day there was no YouTube, Facebook or social media. So whenever we used to have doubt, what we used to do? We used to go back to the textbook, we used to read. But nowadays even the student have a small doubt, they'll post on the Facebook or they will ask their mentor. We are here for you only, dear aspirants. But remember, you should know whether it is a doubt or unknown concept. Like for example, if you see such a question like patient is having multiple oral ulcer, penile ulcers and ocular pain. Okay, you are not knowing what the answer is. Okay, for you the options are like you have not seen any time, like secondary syphilis, you don't know what is EM, there is erythema multiforme, or primary herpes simplex virus, or Beckett syndrome. So aspirants, please remember that if you are not knowing the question, what is given the question, it means your concept is not clear. So you have to go back to the textbook and you have to read. Okay, if there is a genuine doubt, you can post to us. You know what will happen? For example, if you are not knowing this 4 option, you will go back to textbook and you will learn 4 concept. So that will be add to your knowledge. But if you ask the question to your mentor or just post on the Facebook, you will get answer, but your concept will not clear. And remember, in exam to score well, you require a concept. And always I tell my student to follow the rule of 2 or 10. It means what? For example, you are studying herpes simplex virus infection. You don't like to study full. At least study 2 points or maximum 10 points. That will cover your maximum MCQs from that topic. Okay, fine. So remember aspirants, you should know whether it is your genuine doubt or unknown concept, and please follow the rule of 2 or 10. Then books to refer for NEET MDS. Aspirants, you can refer your any MCQ book. Remember, MCQ books are for your practicing the MCQ and they will assess your knowledge, but you have to refer the standard book. Please aspirants, don't refer substandard books. Many students are asking me, sir, why can't we study Balaji for the oral surgery? Aspirants, this is not the right book. Why? I am telling you to refer the standard books because it has been recommended by your DCI, and from there only we prepare the questions, and from there only questions will come. So aspirants, you can refer my website. In that playlist I have given the books for NEET MDS. According to year wise I have divided, and I have told which topic to read from which book, and I mentioned all the standard reference book. So please go through that video once before starting your subject. So friends, now how my academy will help you. So we have virtual WhatsApp lecture and pure online lecture. So what's the meaning of this virtual WhatsApp lecture? So friend, this lecture will include the voice notes, images and explanatory videos. We have around 50 lectures. So the advantage of this lecture will be that you can save it and you can access it any time. It will be on mobile and in your laptop. For example, today we have the lecture and you're not well or you cannot attend the lecture, no problem. It is there in your WhatsApp. You can save it, you can download it and you can read it whenever you are free. For example, you're traveling anywhere, you're in the college, you can just pin up your headphone or headset and you can hear the lecture. So that's why we decided to provide such virtual WhatsApp lecture to the student. And it will be helpful to you during your revision. Like 15 days are left for the examination, you want to revise, just open your mobile and just go through it. Then we have pure online lectures also, like we will have the Zoom meeting or we will have the live YouTube lecture. So I will use this lecture for the purpose of the image based discussion, for your interactive session and for paper discussion. So why, friends, I am not taking all pure online lecture? Because I know the student have a attention span of around 40 to 45 minutes. So when you go for pure online lecture, sometimes what will happen, we'll not well, we'll feel bored, we are tired from the college or from our clinics. 100% we cannot give on the pure online lectures. And such lectures are very heavy to store, and even if you store it, it's very difficult for you to access. That's why we have keep the combination of the virtual lecture as well as pure online lecture. Then we have a website, exam website, in that you can give on laptop also and mobile friendly also. So no need that you should have the laptop to access my exam. You can watch, you give the exam in mobile also. Then we have a separate practice exam after every lecture. That rapid exam will be there. That will be help to know that how much you are attentive in the lecture or how much more you have to go through it. Then we have weekly test. NEET format we have, AIIMS format we have, as well as for the government students we have the format. So you will feel that pressure of examination. Then we have notes of quick reference. Then I told you I have PPM series. There's a physiology, pharmacology, medicine. I teach them unique way. Every month we'll deal with 1 to 2 systems. So you can interrelate all these 3 things and you can study. Because it is right to say that if you know the physiology, automatically pharmacology and medicine will get through it. Then friends, we'll talk about that we have one more special features in our lecture series, that you can select the full course with test series. If some students just want to select test series, they can select, and even you can select the single or the group subject. Like if for example you are weak in community dentistry, select learn from us only community. So you can contact me for all the help. So just I will show you how the schedule will be there. Every month we will have the 2 long subject and 1 shorter subject. Like for example, we can take in June, we have the operative endo, they are longer subject. Then we have radio lecture, we have image based lecture every month, and we have PPM one. So like that we'll go on. This is just sample for June and July month. We have to study till December. Then format, already I told you, we have image lectures, high text, voice notes and explanatory videos will be there. Then we have online lectures also in the form of YouTube, Zoom meeting, whiteboard lectures are also there for you. Then we have the schedule, you can say we have the exams on Saturday and Sunday, and at the end of the month we have the progressive unit test. So in that progressive test we have the combination of the subjects plus we have the inclusion of PPM, so that you can revise again and again. So that will convert your short-term memory into long-term memory. And exams will be in the format of NBA only, like your NEET exams only. We have 100 MCQ for every exam, and NEET and AIIMS pattern will be 240 MCQ. We have progressive unit test, PPM, we have numerical exam, image based exam, as well as separate question will be provided with every lecture. Then regarding fees aspirants, for the 50 lectures and around 50 exam, we have reduced the fee, and first time anybody in the India have introduced this format of monthly payment. So monthly you can pay as per your convenience. Even you can pay for the single subject also, and you can also join our test series. So these are our fee details. And fan, any help you want, since our fee details, we are not rigid, you can approach to us. Then at the end I will talk about the mental balance in preparation. So aspirants, along with your preparation, mental balance is required. So when you are studying, the negative people will come to you, they will harass you. Don't get harassed. Remember, in life we have 3 circles: inner one, middle one and the outer one. Inner circle, only you are there, your goals, your dreams are there. In middle circle you have your parents and close friends. In outer circle you have those family members who are annoying, your relatives, and your neighbors. So remember, your life will be affected by that inner circle only. As circle will go far, they are not going to affect you. For example, you are sitting at your home and something happened 10 kilometers away, that will not going to affect you. So same way your life should be there. Your life should be affected by your inner circle only. Your own thoughts only should affect your life. Somebody is telling you anything, just ignore. Focus on your positivity. have trust and patience. Fine friends, so that was all for the orientation lecture. Thank you all for attending. Any doubt, I am there for you. You can contact me, my number, my website, my mail ID, and this is my YouTube channel where you can check out NEET preparation tips and also a few videos related to subject. So friend, please pull up your socks. Time has come to show your immense potential, work for 6 months and get through the government dental college seats. Take care. See you soon.